I'm Susan Michaels-Strasser. I'm the Senior Implementation Director for Human Resources for Health at icap at Columbia University in New York City. Join me as I talk to some of my friends and colleagues working in nursing around the world today. In today's episode, we speak with Lindsay Calabrese, a nurse working on the front lines of the COVID-19 pandemic here in New York State. Welcome, Lindsay.
Hi, thank you for having me.
It's wonderful to have you. And I know that you are working at the epicenter of the COVID-19 pandemic here in the U.S. But before we get started, I'm hoping that you would be able to share some of your personal journey with our listeners. Why and how did you become a nurse?
It's a wonderful question. Thank you for asking. I think we all have our own journeys, and a lot of them relate back to the care we received or our family members received when we were younger or starting out. For me, that's still true. I saw wonderful nurses caring for my mother during her illness when I was a teenager. And they still resonate with me today. I went on and received a BA in history. Wasn't really thinking about medicine at that time. But then as I graduated from college, I came back home and started caring for my grandparents. And through their care and the influence of family members, it became clear that nursing was really something for me. So I held on to that and went back to school. I received my associates in nursing from Monroe Community College here, which is an excellent diploma degree nursing program. And then I just finished my bachelor's in nursing from the University of Rochester here in Western New York. And currently I'm enrolled in their master's program, so for clinical nurse leadership. So for me, it was just a combination of life experiences and wanting to find a way to influence the world in some small way. And that was the most obvious, direct manner I could do so.
Wonderful. Thank you. You've surely been busy and really accomplished a lot in what sounds like a short time from completing your undergraduate degree in history and really going on to gain this nursing training and all the way to a master's level very quickly. So congratulations, and congratulations on completing your bachelor's degree.
Thank you. Thank you. Yeah, it was exciting.
Yeah, congrats. And definitely what you're saying resonates with me right now around the need to find ways to bring change in the world. I think COVID-19 has really highlighted a lot of the dysfunction and disparity in our world here in the United States. It's been very clear that social determinants of health affect who and how severely people are being impacted by COVID-19. And then more recently, the protests that are happening because of the appalling conditions and death of George Floyd. So we need more people like you who really have a social mind and a passion within healthcare. So thank you. I would like to ask you, how are you and your peers responding to COVID-19, to the outbreak? Here in New York City, as you know, we've been heavily affected, but also in upstate New York where you are, I know there has been significant challenges. So how are you and your peers responding?
So it's been a whirlwind. There's no really easy way to say that. It's been interesting and changing and dynamic day to day. Reflecting back to the start of this, the institutional start of it in the beginning of March, things just happened very quickly. I had known about this virus for some time, a number of months. I've been listening to my podcasts and to my radio stations and my NPR and kind of was in the know. But I still had this feeling of being untouchable. This feeling that like the United States was protected in some way, that we were somehow, this could never reach us, that this wouldn't affect my day to day. That started becoming, those cracks started happening, I would say in late February, mid to late February, I started to realize that wasn't necessarily true. And then I started to think about, even though Western New York is not as much of an epicenter as, say, New York City, we are very connected to New York City.
Right.
And we are, have a lot of industry and schools here in this area. And so we have a lot of traffic globally. And I started to realize that, our current way of being wasn't going to stay. From a job perspective, from my career perspective, I left work one day, nothing new, and came back. And the next morning, I work overnights. The next morning, I was asked if I'd be willing to work on a dedicated unit, because at that time we were thinking we could isolate it right in one unit. And I was willing to, even though that meant leaving my current workplace and kind of venturing out, which is something I'm used to. I work as a float nurse normally. And so
a unit dedicated to COVID.
Yeah, like just dedicated to COVID. And so I signed up willing. They couldn't ask me quick enough. I was happy to. But I had a few days off and I came back and everything was different.
Can you describe that a bit, how it was different only after a few days?
Sure. We were receiving emails quickly in rapid fire about the changes happening in the hospital. The hospital immediately changed its visitor policy, which just changes the general dynamic of the hospital. Obviously gets much quieter. It changes the way, our workflow goes, whether it's days or nights, whenever you're working. If you don't have any visitors or things are, more contentious between who's allowed in and out, obviously that changes the atmosphere. There was suddenly a tent outside of the trauma center to triage patients safely, which, just from the outsider looking in is interesting. But then to be a nurse in PPE, looking out a window, taking care of a COVID patient, and then looking out and seeing the tent, it's just a real realization of what is really happening. I think for nurses, it's very easy to get in our minds about like our patients, and we're very focused, and that's great. I mean, that focus is what saves lives at the end of the day. But to see that juxtaposed between what we're doing and what's happening in the outside world, and there's no real divide, I think was really awakening for a lot of us. So things were just rapidly changing. And I think at first we were all just like, give it to us, like change. We knew it was coming. And then over some time, you just get kind of exhausted by all the change, and you're wanting to have some sense of normalcy, even in an, abnormal situation. So I think that we've been dealing both collectively and personally, obviously, but collectively, we all really were touched by all the outreach of the community. We received a lot of meals, a lot of gifts, and, that was all really, that's been wonderful. Just to feel that community support and to have the children send us letters and cards. I mean, that is just so remarkable. Fast forward a couple months, a month here or 6 weeks here, we started having people who we didn't think were going to make it now live, surviving, and some of them going home to their original homes and with their families. And that is the most rewarding part. And to hear those stories and to start getting that influx of letters and news articles and seeing those names and faces that we cared for, I think has, at least for me, kind of revived that spirit a little bit. So I think for the most part, we've all been just kind of dealing with this world that changed really rapidly, and then also we can no longer compartmentalize our work and our home life. It's all kind of the same.
Connected, yes.
And I, what I'm doing, especially for myself, because I'm working exclusively with COVID patients and have been since the beginning of March, my work and my home are now almost the same. Like the topic is the same. And so it's been hard to shut that down sometimes and escape from it. And so I've been hearing a lot of my colleagues and I talking about the things we're doing that totally turn our minds off. For me, I've gotten deeply invested in podcasts instead of music, because then I'm thinking about what we're talking about instead of my own background mind. I've been very conscious of when I'm home, turning off my email and disconnecting from my work life. And trying to disconnect from some social media. I'm not great at it, but I know we're all trying to make that effort a little bit because it's been so much constantly. So I think we're doing okay. But I think that there's been a lot of just rapid change that, on one hand, nurses are really used to, and on the other hand, has been so different from our norm that we've had to rally in other ways, like through each other and through the community. The community's been a huge part of that.
And so it's brought people closer together, it sounds like.
I think so. I think for me, it's hard to say. So I have been working now all these months on COVID with people that I've never worked with before. I went from I'm a med surg nurse, traditional, like in my role for the last 2 years. I have some progressive care training through our neurosurgery line. And with this, I've been paired with an ICU nurse for the duration. So I've been caring for progressive to ICU level now. And that's a team nursing model we've come up with in response to the influx of patients. And that's been, for me, almost an orientation of such to critical care nursing, which has been wonderful. But it also meant that I no longer have my normal support system. I have, completely, I'm with people I did not know previous to this.
A whole new team.
A whole new team. And even within that team keeps changing because, the critical care nurses are floating in and out. And there's a core group of us that are always the same, but, obviously staff has to flow in and out to meet needs. So yes, we have rallied closer together. I think we have gotten closer than we would have otherwise because we're all kind of in this same emergency mind. And I think that we all just are trying to do our best and trying to be aware of each other's needs. I think a lot of times in all human behavior, it's very easy to be self-focused about what's happening to you. I think this has really given us an opportunity to all be like, oh my gosh, we're all stressed. This is not great for any of us. This is not ideal conditions for any of us, mind or physically. And I think one thing I've been keep trying to remind people of is that most of how people act towards you has more to do with what they're dealing with. So try to give each other a little bit of space. She probably didn't mean to have that look and wants the best for her patient. And I hope someone gives the same to me. So I think we've all grown in that to be to give each other that space. And I think that's been really rewarding. That's, that's hard to do sometimes. And I think I think that's in that way, I think is the best way to describe that.
It's really important. And I really appreciate what you said about self-care and having some extra patience for each other, because we know that health workers have really, it's taken a toll on their mental health. And I think everyone, I read today in the news, up to a third of people are showing signs of severe or significant anxiety. So it is something that we are, as a society, grappling with. And then as nurses and other frontline health workers, like you said, it's very hard to switch off from it. So it's good to see the types of self-care practices that you are adopting through various things, podcasts and others. It's really good to hear. Here in New York, every night at 7 p.m., there's a clanging of pots and pans and, this celebration. And I think that is a group or a societal way to let go of some of that anxiety and tension in a very physical, demonstrable way to say, we're all in this together.
Yeah. That's been so nice to see, even on the, on social media and on the news. I'm not witnessing that here, but I don't, it's just because we don't live in those close quarters in that same way.
Right,
but we have had, cars, like parades going through by the hospital and stuff.
Oh, okay. Very good.
Touching, and seeing the videos from New York City have been wonderful. I just want to make one comment about mental health, because I think it's so important to just to break down those barriers. And, my institution has been really great about always having employee assistance programs. And, they've been very, they've been blasting it out and, ramping it up and making sure that people know they have access to it. And I just want to reduce the stigma and, just say that, I've been seeing a counselor. I've seen them throughout my life. And in the late part of last year, I started seeing someone regularly, and it's been so beneficial for me. I found her through my employee assistant program. She is she is a licensed therapist who I've been meeting with biweekly to work on my own issues, but to work on my, health care worker related issues and the stress I'm feeling and the burnout I feel and the mix of emotions I have felt with this being both in my workplace and my home. And so, if you're expressing any of those feelings of burnout, I really, really encourage you to not only speak to your fellow nurses, but if your manager is someone you can turn to get assistance, or to just anonymously go to your employee assistance program, please do so. And we need to make sure we take care of each other. And it's okay to not want to be vocal about it, but make sure you're internal about it.
I think that's great. And there's a saying going around, it's okay to not be okay.
Yeah.
And frontline health workers are just this repeated stress. And it takes its toll. And so thank you for sharing your personal journey and your positive experience in taking a proactive stance on safeguarding your own mental health.
Yeah.
I'd like to now move to what brings you fear right now amidst COVID-19, and what is bringing you hope? So let's start with the fear, and then we can end on a more positive.
Yeah. What brings me fear? I think what brings me fear right now is the push to reopen. So for me, and I know my experience is slightly different than New York City, we never really hit this really overwhelmed sense in our hospital. So in my experience, my hospital's kind of always overwhelmed. I was like, where are we going to put anybody new? I'm, used to that. But once we, cut the non-emergent surgeries, it was clear that we did have room when needed, which was important. But, I kind of felt like for a long time, I was just waiting for this tsunami to hit, right? Like I was just waiting and waiting. And it got bad there for a while. Like it was not great. We were very busy. And in the COVID ICU, we were incredibly busy. And patients were not doing well. While the rest of the hospital was eerily quiet, and my other nurse friends were saying, oh, we don't have a lot of patients. And so there was this total difference. And then lately, the ICU admissions have started to drop, and the regular admissions for COVID, like the floor admissions, like non-ICU admissions are rising. And, but with reopening, I'm afraid we're going to see a rise in both. And I understand that we cannot stay closed forever. I absolutely understand that. But this general feeling, and it's actually a term my a way that my friend was actually saying it to me is that she feels as though that people that she knows are just over it. So like, it's like out of sight, out of mind.
Right.
Nobody I know got hurt, so we're done. And that mentality is what scares me, because we're not done. This virus is not finished with us. It's not going anywhere. And we did a really good job flattening that curve in the beginning. But if we don't be vigilant on certain measures, we're going to see that curve rise. And when that curve rises, it's not just that our numbers increase to a way that is unsustainable, but our moral distress that we talked about.
Right.
My role in the most critical patients of this region gets compounded. And, luckily we haven't had any trouble providing adequate care to whoever needs it. We haven't had any shortage of ventilators and things like that. But my concern is that we could. And, my concern is that we've already, had staff working on this for so long. We're humans, we get tired. And I worry that we're going to see an increase in, and I worry how that feeling of I didn't know anybody is going to change, because now they will.
Yeah.
And that's going to scare people, and it's going to just cause a ripple effect that makes me nervous. I don't know what will happen. I think we're totally in unprecedented times, as everyone's saying. I can't tell you what my fear is going to look like. I just can say that that's my fear.
That's how you feel.
Oh, that we open up and it's going to create this flood that I've been waiting for. And I think that's my biggest fear. And I fear for my family. I haven't seen my father since, I've seen him like from outside my window, but I haven't held him or hugged him or been in any contact with him in 3 months. Gosh, I've moved back a time. And, I think that's hard.
Sure.
And I understand where people are coming from and that they're kind of over it and they want to see their friends and family. I also don't want to lose another family member. And so I'm kind of in that middle place where I'm fearful to see him, but I'm also feeling like, for how long am I not going to see my 60-year-old father? Or my nieces and nephews who are growing like weeds. And so the fear of missing out on that stuff is also real. So I guess my fear currently just comes from us figuring out figuring that section of it out.
Right. This next phase.
That unknown, and just keeping the trust of the public that we're really trying to do our best for you and for everyone. And if we're telling you that the only way to help us is to stay home, we promise you we understand how awful that is. Even personally, I understand how hard it is to keep that social distance. But I also am resolved in knowing that it's important in some ways.
Right. We're definitely seeing a change here in New York. People are really itching to get outside and to congregate. And people have been going outside, going shopping, to the grocery store and the pharmacy. But now I'm seeing more people congregating around restaurants and bars. Obviously, they can't go in, but people are definitely congregating outside, and many people are wearing masks, but many are not. And that makes me very nervous as a nurse and as a citizen, like you said.
It makes me nervous. I will say, even myself, with the weather getting warmer, I've been more active outside. And so part of me as a nurse is like, yes, be more active, we need to live this healthier lifestyle as a community, as a global community. And so I'm really encouraged by that. But also, I want you to cross the street when I'm coming, or vice versa. I want you to wear your mask. And large, I've seen that in public when I'm out and about. So I think that's great. You mentioned briefly the George Floyd and his tragic death, tragic murder. I am with these protesters, and I understand their absolute fear. I just ask that they wear a mask and wash their hands. It's hard for me. I want us to still keep a little bit of distance. It's hard though, because humans are social creatures.
Right.
And
Right.
we suffer greatly when we can't be social
Exactly. Yeah. So we're in this weird balance.
And so I just, I guess my thought is that we all have to give each other that space to figure it out on our own.
Mm-hmm.
And, that's all.
Yeah. Which you talked about earlier with your colleagues, giving each other a little more wiggle room if people are tense or anxious or a bit abrupt. So let's switch now. What brings you hope?
What brings me hope? Well, I think that children have been so resilient during this time. Seeing their cards and the Girl Scout cookies, and we have a wonderful community up here in Western New York. I have been touched by all that. I've been touched by the patients that have spoken up to our local news and thanked us nurses and doctors. I've been touched by, this is so silly, but Donuts Delight here in town has been putting scientists and nurses on their donuts, like printed. And it's so silly, but it's so wonderful to see our nurses and doctors and scientists and researchers and lab technicians celebrated in the way that we do NBA stars and, celebrities. And I want to see a community that does that more. And I think that gives me hope that even in these times where we feel like science hasn't been given its due diligence, that underneath it, most of us know the place that science has in our life and knows that who we really need to listen to. And so I was really touched when everything shut down, and it really seemed like people listened and took it seriously, and still take it seriously for the most part. And I guess the community brings me hope that we really can do this when we need to. And when it's really pressing, that amazing things can be done, that things can happen very quickly, and the support can be there when, the public is really rallied around a cause. So I guess that brings me hope. I hope that continues, and we can maybe turn it into other things we need to work on as time goes.
Yes. And there may be a way to then take this into other areas of our lives where we rally together, as you said, around a common challenge or a common issue, like racism and endemic racism that we see to people's deaths. So I think that I really like that COVID-19 has shown how people can come together and respond and do amazing things. Thank you again for bringing up the issues around mental health and being able to support each other. We really have shown that when we come together, we can do amazing things. And we have flattened that curve simply by doing what health workers tell us to do, to wear a mask, to socially distance, to practice good personal hygiene. And really, as a society without a vaccine, we've been able to help ourselves significantly reduce the number of new infections. But I agree with you that fear of a resurgence is very real. I feel that as well. And I talk a lot with my family here, my immediate family, and there isn't the same level of concern. And I think as health workers, we know what can happen. We know very intimately how bad it can get. So well, thank you, Lindsay, for your time and for sharing your experiences. As a young nurse, you're gaining amazing experiences, once in a lifetime experiences, very young in your career. And this really sets you up for an important role as a nursing leader.
Yeah, thank you. I just want to mention that I really want nurses to enter that leadership space, to be those voices. We've done amazing work advocating for our patients at the bedside. We are their advocates. We're taught that from nursing school. And I want us to continue that. And I want some of us to continue to do that in the public space as well. Have our voices be heard. We keep mentioning George Floyd and the racism. It's established fact in the medical community that African Americans and people of non-white ancestry have disadvantages that affect their care, affect their outcomes and diseases. And we have to speak up. We have to advocate not only at the bedside, but we have to advocate in the public sphere, on podcasts, on TV. We are educated. Nurses are well-educated individuals to provide this leadership when it's so desperately needed in this country. So thank you for what you're doing, Susan.
Yes, thank you. Beautifully said.
Oh, thank you.
I'll end now saying that definitely we need to use our voice. Nurses must use their voice to affect change and really bring that truth of what is happening, what we see in the hospitals, and sort of that tip of the iceberg of what is happening to people who are marginalized in society. So this year, as you know, is the year of the nurse and the midwife. As we celebrate the nurses and midwives in our individual lives, our communities, and our world, it is time to focus in on what matters. By building more resilient and well-trained frontline health workers, health systems will be strengthened, and not only in the course of normal operations, but more importantly, in these times of crisis, which will allow us to get back to what we all want, is back to our normal lives, where we can interact freely and go forward, affecting change where it is most needed. So thank you, Lindsay, for taking the time, and thank you to all the listeners for joining us.